Hello everyone, I am Dr. Indrakant from Department of Geology, Deskandu College. In this present session of this FDP, I'm going to talk about the entrepreneurship in the era of translational research, application of in silico tools and techniques. I have divided this talk into 4 components, and the first one, I will talk about what is the translational research. Main focus will be about the health science translational research. Second, I will little bit discuss about the plant translational research. Then I will talk about the importance of patent in translational research, funding in translational research, challenges associated with this translational research, and then I will take you a little bit, glance of drug discovery, in silico tools and techniques developed in my lab, in different lab of India. We'll also share some of the success stories in India, and then I will also let you know how you can create your own database and tools. So again, welcome you all to this session, and I'm going to share my screen for your easy understanding and discussion of my talk. So let's start with what is the translational research? The major motto of the translational research is from bench to bedside. Usually, if you talk about translational research, it is basically the central part of any international health policy research and finding initiatives. But the same time, it is also, important to know about the translational research, which has been, characterized as harnessing the, you can say, use of the discoveries from basic science to develop new diagnostic tests, therapies, and prevention devices. This kind of translational research comes under T1 type of translation. Next type is T2 type translation, where implementation of these basic findings into practice to improve care for the patients. This is, I'm giving you a little bit two line about the health translational research. I'll just take one line about the plant translational research. In this area, basically the target is to development of the basic plant research discoveries into technologies or approaches that improve agriculture, which has a vital role to play meeting these challenges like increasing the productivity, pathogen resistance, and sustainability of existing crops, and also a challenge to domesticate new crops. Now, the factor which enables and hinder translational research. Perspectives from scientists' point of view. So I will take one by one. So let's start with the first point, and that is the concept of translational research. Institutional representation of translational research as a pipeline and a process which require acceleration was articulated by basic and clinician scientists as a problematic for a number of reasons. That science was seen as being reduced to solving problems and producing cures rather than discovering new knowledge. A lack of recognition that good science takes time, and rapid selling of biomedical innovations to public due to pressures to translate findings quickly for patient benefits. In the present scenario also you can correlate these things without thinking through the implications of this development or making better use of existing policies and intervention. Theme 2, that is research processes, which includes regulatory and ethics processes, patients' recruitment to research, and informatics and informational technologies. Ethical and social implications of scientific breakthrough were perceived to add an additional layer of complexity to translational research. Role of patients' recruitment and collection of patient samples, tension between the relevance of the human studies and the rigor of the animal experiments. Not only that, a lack of infrastructure to develop skills in translational research acts as a further organizational barrier. Third point, that is research versus clinical care. A cultural divide between basic and clinical science as a key barrier to conducting translational research. It is no great surprise that basic and clinician scientists were divided given they were educated within different faculties with different foundations, management approaches, and hierarchical system, but were then expected to come together to undertake translational research. Fourth very important point is interdisciplinary collaboration. Interdisciplinary collaboration between basic and clinician scientists, but also with other professional groups, was perceived by scientists to facilitate translational research practices by providing opportunities for knowledge exchange, offering distinct forms of expertise, and creating a working environment which encouraged communication and cooperation between different scientists. Collaboration was seen as being best achieved through multidisciplinary team. Fifth point, that is entrepreneurship science or entrepreneurship approach. From a policy perspective, translational research endeavors to improve the health of the nation through development of effective drugs and treatments, while simultaneously increasing wealth by generating income from a nation's research capabilities. Translational research, therefore, comes with health and wealth-based performances and ensures for those working within translational research environment. If you talk about the another important component is the background tracking model. It's a very good paper, Dew et al. He has explained this model. And in this model, the most important part is the pace of the basic discoveries in biomedical research is accelerating. However, the translation of this knowledge into concrete environment in clinical medicines continue to lag behind the pace of discoveries. The backward tracking model for measuring knowledge transfer in the whole translational research spectrum by using the drug patents, paper, grants, backward linkages. Researchers tried to figure out the funding, science, technology, innovation, translational patterns, and ponder some policy implications. An example, which priority areas and knowledge convergence level are more likely to generate new drug? Also, such value patents in FDA Orange Book tends to cite scientific knowledge published on average 10 to 15 years ago. The technology linkage to new drugs is relatively stable, while the science linkage of technology inventions increases rapidly. Among the scientific papers cited by drug patents, private institution originated paper are only a quarter of the public. By linking these scientific papers with funding source, a large majority, approximately 90%, are public funded, and only a very small part are private funded or the public-private joint funded. There is no obvious relationship between basicness and linkage to resulting patents, impact, and to drug innovation. A balanced basic research and applied research may be essential for fostering drug innovation because it is a complete chain translating from basic discovery to clinical evidence, then to clinical practice. In order to achieve successful pharmaceuticals innovation, rather than focusing on only technology, convergence with science at moderate level is suggested by this model. If you see the overall, the distribution of scientific papers by essential science indicator research areas, I will broadly divide it into 4 categories. Chemistry, which is approximately 12%. Pharmacology, which is approximately 24%. Clinical medicines, which is approximately 34%. And besides these, 3 component, rest is left about 30%. That covers almost all rest of the, discipline of the biology. For example, biochemistry, neuroscience, multidisciplinary nature of all these different, the discipline of the biology, immunology, molecular biology, microbiology, etc. So if you see carefully, you can find the molecular biology is approximately 3%, and immunology approximately 3%. So my major focus is basically in these 2 areas. I have already told you, like the 5 important things, and one of the most important part is importance of the patents in translational research. An understanding of patents landscape is an essential process of the translational research and development of innovation. Patents, can have the impact at the research stage, at the point of commercialization, when diagnostic tests are used in the clinic, and the use of technology or tests which infringe valid patents could lead to enforcement action, which can be time-consuming and expensive for both parties. Therefore, researchers may wish to protect the intellectual property arising from their own research, and therefore must understand what existing patents there are in order to understand how their research may be innovative. You must have, when you were kids, you must have seen the Donald Duck, what you call the cartoon programs, and this I have taken from one of the, I forget the name of the article, and I found this very apt for this presentation. Here you can say the heading is guarantee your novelty. The top panel, what you are seeing, the picture is, that picture is of 1964. Dutch patent number was NL6514306A, was filed based on the idea by Danish inventor Kreuers that sunken ships could more easily be salvaged by using air-filled balls to increase their buoyancy. The patent was not granted as the invention had already been disclosed in a 1949 Donald Duck episode entitled Sunken Yacht. Interestingly, popular TV show Mythbusters recently confirmed the feasibility of approach taken by Donald and his nephews. So, whenever you apply for any of the patent, you must aware about, this kind of problem. I'm aware a little bit about it before because recently I have also filed one of my patents in India that is basically on methods for identification of multi-drug resistant MTB. So basically, why the important part of my patent is there are many already ongoing techniques for testing the MDR resistant patient, but still there are a need to improve those techniques because that is not, the 95% or more than that confidence level is not so high. And resultant, sometimes the doctors are completely dependent, besides the symptoms, they are dependent on the reports. And imagine if that is a false positive or false negative. If you are from biology field, even if you're not from biology field, simple example is if a patient is MDR and report says the patient is not MDR, then imagine what will happen. The doctor will use the simple drug and result will be, the lot of side effect. There is no improvement in the patient. Vice versa, if patient is not MDR and doctors are administering drugs which is responsible for MDR, you can imagine their side effect. So this is very important to develop more tools and techniques which have more confidence level and have good, a quick, outcome and to, come out with the good results so that a doctor can do the perfect job. Now, the next question after I told you in this part of my talk, I'll discuss a little bit about where to get funding for the translational research, where to look for. I'll give you some examples like government have already taken many initiatives and few of them are like Direct Welcome Trust Partnership. A lot of people, young researchers are getting this fund to start this translational research. DBT, a Small Business Innovation Research Initiative, SBIRI. Third one is DBT Accelerated Translational Grant for Commercialization. Another one is DBT SERB, industry relevant research and development projects. And besides that, there are a lot of, MSMEs also started giving, you can say, a startup grant. So these are the place where we can look for the funding. Now, but it is not easy. So definitely there are many challenges of translational research. Translation is often a long and arduous process. Not all fundamental discoveries will necessarily lead to direct or immediate outcome, such as patents or magic pills. So overly focused or finding quick fix treatment may lead to impatience among researchers for scientific progress. Impatience for immediate result may do more harm than good outcome. Building the appropriate infrastructure for human investigation, that is very important. So these are the challenges. We have to come out of these problems. Training and stabilizing the career of young scientists and physicians interested in requisite work. educating academic investigators about the regulatory requirements inherent in successful therapeutic discoveries and development, finding more efficient ways to match good ideas with adequate funding resources. So I will take you to the next topic I will discuss in the next session of my talk. Thank you.